This topic is about the biting mechanism in snakes. How do the snakes bite? How do they release the or deposit the venom in the body of prey or in the body of enemy? Why do they bite? Why do they release the venom into the body of other animals? There are two categories. One is prey, another one is the enemy. To protect themselves from the enemies, they can bite the other animals, even the human beings. For the purpose of food material, they can catch their prey, they can release or deposit the venom into their body, and they can hold them and they can engulf them or swallow them. For these two purposes, the snakes bite. The biting mechanism is somehow complicated because the development in the skull, that is the dicondylic skull, to facilitate the biting mechanism in the body. Actually, luckily, fortunately, we have most of the snakes are non-venomous, non-poisonous snakes, but only few cobra, vipers, and some snakes are venomous snakes. Mainly these hydrophilic sea snakes are highly poisonous. Those are neurotoxin. Those can release some neurotoxins. But in this poison, there are different types of poisons are there. Some can arrest the muscles. Some can clot the blood. Some can arrest the nerve impulse propagation. Some can damage the tissues or cells. There are 4 to 5 types of poisons are they released by the different snakes. Before discussing about the biting mechanism of the snakes, what are the parts involving in the biting mechanism? We have to know. Here the fangs. These are the fangs. These are the fangs. These fangs are actually tube-like structures, hollow structures. Those are pipe-like structures. Actually, the poisonous glands are located here. Those are actually modified salivary glands. From here, the poison transported like this. Those can enter into the pipe-like structure called the fangs. Those are released into the body of prey or enemy. Those fangs. And the jaw muscles. These jaw muscles are mainly involving to catch the prey or to reach the enemy immediately, because these jaws are not attached at this region. And at the time of biting, they can the muscles are retracted or contract. The jaw muscle or maxillary muscles are contract. They can press the poisonous glands. Then the poison is released and they can transport it by the vessel, and they can enter into the fangs. They can transport it to the fangs and they can deposit it in the prey body or the enemy's body. Actually, there are 3 step-by-step processes are there in the biting mechanism. Fangs, jaws are involving in this main. But another thing is the flexible development in the skull. Yes, this is dicondylic skull. With the help of this dicondylic skull, it can move the head forwardly within fraction of second towards the enemy or prey. So first in the biting mechanism is opening its mouth. The jaws are very flexible due to the presence of dicondylic skull. The dicondylic skull is facilitating the movement of head very flexibly. The jaws are actually not fused at the front. That's why they can move very fastly. It can open its mouth very widely. Then what happens? These fangs are opened. At the normal stage, these fangs are open now, but at the normal stage, those are withdrawn into back. At the biting time, these are open. They become vertical. But normal stage, these are folded. So that is the first stage. They can open the mouth very widely. The fangs become very straight. And the second step is erecting the fangs. The fangs are becoming very straight at this time. The fangs are actually located at the upper jaw only. The venomous stage, these fangs are folded back at the normal stage. But when the snake wanted to bite the enemy or prey, they become very straight. The third step is injecting the venom. Once the fangs are penetrated into the prey or enemy, the muscles behind the eye are contracted. The maxillary muscles are contracted. They can cause some pressure on the poisonous glands or venom glands. Then what happens? The poison is transported into the hollow fangs. They are at the tip of this fang, a small hole is present. These these fangs are inserted into the prey body or into the enemy body. Within the fraction of second, that poison or the venom is deposited in prey or in the enemy's body. They can release or deposit the venom or poison in the prey or enemy's body. So in this poison, there are 4 or 5 types of poisons are there. For example, neurotoxins can arrest the transportation of nerve impulse. They can stop the signals. Immediately that organism will die. If hemolytic toxins are there, for example, these can damage the red blood cells or allow the clotting of blood. They can halt the transportation of blood. They can and some are myotoxins also there. They can stop, they can arrest the movement of muscles, for example heart muscles and other muscles. Then some are cytotoxic poisons are also there. They can damage the tissues in the body. Those are called the cytotoxins. These are 4 or 5 types of toxins are there. According to the type of toxin, the effect in the body of prey or enemy is there. The effect may be immediate or the effect may be somehow delayed. If these are immediately treated, the effect may be reduced. If you know the snake, the doctors will give the particular anti-venom injection. If you don't know the snake which bite, the polyvenom injection is given that can work on any type of poison. But in the prey, the poison is released into the prey body. That may be neurotoxin, or it may be hemolytic toxin, or it may be myotoxin or cytotoxin. Whatever it may be, the toxin that can kill the organism. But before killing the prey, after catching the prey, what happens? That can releases the poison into its body. If that prey is dangerous, immediately that can release. The snake can release that prey. If it is not edible prey, that can release immediately. If it is a dangerous prey, that is also not consumed by the snake. But there is one question is there. If it bite the prey, the venom or the poison is released into the body of prey. Then after, this snake can engulf that food material or swallow that food material into its digestive tract. Can the venom released by the snake causes any harm to the digestive tract or to the body of poison? Means this snake is also one organism. If hemolytic or neurotoxic or any other poison may be there, if it enter into the body of snake body, can it causes any harm to the body of snake in the digestive tract? Normally, these are neurotoxins or myotoxins or hemolytic toxins or cytotoxins. Actually, for the effect of toxin to work the toxin in the body, that should be enter into the blood first. That should be transported all parts of the body. There should be no enzyme to neutralize this poison. But this food, the prey is entering into the prey with the poison is entering into the digestive tract directly. In the digestive tract, the enzymes can neutralize the poison. And especially in the snakes, some of the factors, some of the chemical factors or enzymes are there to neutralize this poison once again. Okay, in our body, if the poison is injected, if we will take the snake poison into our digestive tract, our enzymes can neutralize them. But in the snake's body also, the poison is neutralized. That's why there is no effect to these snakes.